of mayors. So I'm pleased to moderate the second hour of our high-level panel with two very distinguished mayors who happen to lead cities that are COVID-19 hotspots. I'm going to ask them, I'm going to introduce them first, and then I'm going to ask each to make opening statements before we get into a moderated discussion. The first mayor I'd like to introduce is Mayor Josefina or Joy Belmonte, who was elected mayor of Quezon City in 2019. She was previously the vice mayor of Quezon City for 9 years, presiding over the city council, which has been regarded as the most outstanding in the Philippines in accordance with the exemplary standards of the local legislative awards, the Department of Interior and Local Government. She graced us last year with her participation on the high-level panel at the inaugural Fast Track Cities 2019 conference in London. And we were all so very impressed with her leadership across so many issues, including public health issues. She believes that having a trustworthy leadership, as well as an efficient and well-functioning and effective government system within the City Hall, can win the trust and confidence of the people. And from what I've heard, that's absolutely true in Quezon City. I'll go ahead and introduce the second panelist as well very quickly, and then ask Mayor Belmonte to start with her opening remarks. Our second panelist is the Executive Mayor, Jeff Makubo of the City of Johannesburg. He was elected into that position also in 2019. Previously, he held positions in the council, having served as the leader of the opposition in council from August 2016, as a member of the Mayoral Committee for Finance in the City of Johannesburg from 2011 to 2016. He has also held the positions of leader of executive business in council and that of chairperson of the governance cluster. Thank you very much, Mayor Makubo, for joining us as well. So, Mayor Belmonte, if you don't mind, with your opening statement, please.
Good evening, Mr. Zuniga. Good evening to everyone who is here today. I say good evening because it's about 9:30 in the evening in Manila or in Quezon City. And well, with your permission, I'd like to speak a little bit about the HIV response of our city in the context of COVID-19. So first and foremost, I'm grateful for having been asked to speak at this high-level panel. After our Fast Track Cities conference in September last year, Quezon City, as the Philippines' most populated city with 3.1 million people and about 10% of the nation's HIV cases, reiterated its commitment to ending HIV in our city by the year 2030. Thus, on December 2, 2019, because December 1 was on a Sunday, in commemoration of World AIDS Day, we launched a citywide campaign with all our stakeholders present, which we called Quezon City hashtag Ready to Stop HIV, ready spelled with a capital R-E-D, or as we also called it, the Zero at 30 campaign. We presented a roadmap that aimed at zero new infections, zero discrimination, and zero AIDS-related deaths by 2030. We aim to remove the stigma of getting tested by encouraging persons of influence in government and civil society to get tested in public. Our message, know your HIV status. The program was envisioned to include making testing widely accessible to the general public by capacitating our community health centers with laboratories for HIV testing and adding more social hygiene clinics and sound-down clinics to the 4 that had already been established in our city. Moreover, we had begun the process of amending our current HIV/AIDS ordinance to include, among others, ensuring multi-sectoral participation in addressing HIV programs and policies, the lowering of the age limit for testing without parental consent to 15 years old, the inclusion of progressive prevention initiatives such as condom education and access, ensuring the ready availability of treatment and services for persons living with HIV, among many more amendments. We had already conducted several mandatory stakeholders consultations before, unfortunately, COVID-19 set in. We are also proud to report that for the year 2020, after our conference and during our budget season, we had increased our budget for the HIV/AIDS response by 100%. Our momentum was cut short in January 2020 when the threat of COVID-19 presented itself. As you know, Metro Manila has direct flights from Wuhan, and so very early on, we had positive patients coming into our city from abroad. The attention of our city, and in particular our epidemiologists, was diverted towards COVID-19. One of the hardest lockdowns in the world was imposed on our country from March 2020 to May 2020. And up to this day, we are still under lockdown, albeit a more relaxed one. Despite this setback in our plans, we are pleased to report that our training in and active commitment to addressing HIV in our city helped tremendously in the way we approach the COVID-19 pandemic. As a previous vice mayor and the head of the city's legislature, one of our first steps was to pass an anti-discriminatory ordinance to protect COVID-19 patients and their kin from the stigma attached to having acquired the disease. The ordinance likewise protects frontliners who are subject to discrimination. Our epidemiologists were also quick to step up to the challenges required to address the COVID-19 pandemic. They quickly applied their skills previously reserved for addressing HIV in our city to doing robust contact tracing and surveillance. We developed a system in which people could self-report with their identities kept strictly confidential. They were well versed in educating and disseminating information to the general public, which is a far cry from our national government's preferred strong-arm authoritarian and punishment-oriented tactics. They put a premium on testing, and as a result of this, we had one of the most widespread community-based testing programs in the entire country. We were among the first local government units to set up a quarantine facility or safe haven for mild COVID-19 patients with a complete set of health workers to provide care and counseling for the afflicted. This service was augmented by the participation of volunteer health coaches from the Philippine Medical Association to care for those quarantined at home and in the nearly 3,000 quarantine bed spaces we eventually provided for our people. As I speak, our R0 has been steadily decreasing for 5 weeks now and is now below 0. If our numbers continue to improve, we will be returning to our temporarily halted HIV campaign, but in the context of the new normal. To date, we are already in the process of continuing our advocacy in the virtual world and increasing our social media presence. We will soon be reviving our peer-to-peer counseling for persons living with HIV, but this time online. And we are also preparing to make sure that all of our services previously provided in the physical realm will all be available to our persons living with HIV under a new normal circumstance on the virtual world. Before then, however, we need to get our data straightened out. For after 6 months without any follow-through, I think our data has become kind of haywired. Last year, there were a reported 436 HIV positive cases in our city. This year, only 192 cases were reported. This number, however, in no way indicates a real decrease in infections without taking into consideration the lack of testing, restricted mobility, and stay-at-home policies. To end, COVID-19 affected our efforts to address HIV, but it broadened our perspective to the need to be prepared, be adaptable, and flexible in order to be able to address all forms of infectious diseases. Thank you very much for listening, and good day to everyone.
Thank you very much, Mayor Belmonte. I'd now like to ask Mayor Makubo to please deliver his opening statement.
Thank you very much, Dr. Zuniga. And let me say good afternoon, South African time, to my my fellow panelist, Mayor Belmonte, and greetings to Mayor Kaunda and all other mayors who've joined us today, and say it's a priceless privilege to being afforded an opportunity to participate in this virtual Fast Track Cities 2020. Just to say that we, one of the largest cities in population and the economic terms in South Africa. We are the most populous, however, geographically we are the smallest. We house about 5.74 million people in Johannesburg. We've got a lot of unemployed youth at around 41%. The unemployment rate is about 32%. However, the development index is sitting at 7.2%. And what we're seeing now is that we're being rated as the most unequal city in the country. We drive our development through what we call the growth and development strategy, which is a city strategy based on the 4 outcomes and 4 pillars. And I'll go through the outcomes quickly because we need to understand them. The first one basically speaks to the improved quality of life and development-driven resilience for all, where our response to health pandemics fits in perfectly. The second outcome, we want to provide a resilient, livable, sustainable urban environment underpinned by smart infrastructure supportive of the low carbon economy. The third outcome is an inclusive, job-intensive, resilient, competitive and smart economy that harnesses the potential of all its citizens. And the last of our outcomes is a high-performing metropolitan local government that proactively contributes to and build a sustainable, socially inclusive, and locally integrated Gauteng city region. Now that's important because we don't live in isolation here as the city of Johannesburg. We are part of a province that has 5 other municipalities that work in concert. They are socially integrated, economically integrated, and we work as one in this province. So we've got principles that underpin what we do. Good governance is one of them. Eradication of poverty, social inclusion through support and enablement, building sustainable human settlement, ensuring resource security and environmental sustainability, and building a growing economy. Now we know that on the 18th of March this year, His Excellency President Ramaphosa declared the national state of disaster, wherein we now live under a state of disaster. As we speak, we're still under the national state of disaster as a response to the COVID pandemic. The numbers are that we, in our province, we've got 213,000 confirmed cases as we speak. And in Johannesburg, the cases are sitting at 84,000. This makes us an epicenter in our province and one of the highest infection rates in the country as Johannesburg. Of course, we've got 92% recoveries. We've had 1,500 deaths as a result of COVID-19. A lockdown was pronounced and we went under lockdown on the 26th of March. And we've seen that during the lockdown, the infection rates were very, very low. As we opened in June, going down the levels, we call them alert levels, we start seeing the peak and the hotspots started moving from the more opulent side of the city to the poorer side of the city. The most populous township, which is Soweto, became a hotspot with the highest numbers, concentrated in an area near mining town and all that. But that has been dealt with and has been contained. We followed what we call a 6-pillar response strategy to COVID-19. The first being the public health response, because COVID is a health pandemic and it needed a public health response. So we had what we call the pharmaceutical and non-pharmaceutical response to this pandemic. Social distancing, wear a mask, wash your hands, just live healthily, keep your place hygienic as part of the health response. Of course, the other was dealing with it using medicines and all that. The second response was food security and social relief. We found that what COVID did, it accentuated and exposed the levels of poverty, the levels of inequality in our city, the levels of food insecurity. families that ordinarily could afford and survive through subsistence or informal trading, during the lockdown, they could not survive. So we had a food security and social relief response, wherein we mobilized the private sector, we mobilized NGOs, NPOs, we mobilized funds ourselves in order to provide food and social relief to our residents, to those who could not afford. The third pillar was law enforcement and compliance. Because we lived under a national state of disaster and it had regulations, so what we had to do was to ensure that the communities complied to the regulations in their own interest, so that they don't spread the virus and we can contain the incidences of COVID-19. So we had our police, we had our Metropolitan Police and the Defense Force patrolling the streets, ensuring that people are at home, if they are at the shopping centers, they're socially distanced, etc. The fourth pillar was economic response. Because of the impact of COVID, many businesses closed, people could not go to work, the economy took a beating. In fact, we've had the largest contraction, GDP contraction of 51% in Q2 as a country. Joburg had a large share of that contraction because the businesses were not working in Q2 of this year. So we had an economic response on how then do we, while we respond to the public health pandemic, how do we respond to the economic collapse of the country, so that in the city. So there are certain things that we do to under the economic response. The fourth was the capacity of the state. So as the pandemic hits our city, we still have capacity to continue delivering quality municipal services to our residents while we are fighting the pandemic. And we realized that we had gaps, but we had to quickly close those gaps, especially during the lockdown. That water must still be provided, refuse must still be collected, sanitation must still flow. Where there is no water, we provide water tanks and temporary relief. Where the sanitation is low, we can provide chemical toilets and all other services that are needed by our communities. So the municipal services continuation, it became a key pillar that we focused on. So as our employees contracted COVID-19 or infected, we had to have augmented services to keep the services flowing. So we had to get contractors out. When our depots closed, we had to get augmented services. So to ensure that the city runs while we run the pandemic. The last pillar is called social mobilization and human solidarity. We realize that government alone, especially the city government, cannot fight the pandemic on its own. So we had to go into a united front with churches, with religious bodies, with sports bodies, with social enterprises, for facing this pandemic, fighting it together with our communities. Mayor Kaunda earlier on referred to what we call ward-based war rooms. So each ward in our municipality had to form a ward-based war room wherein we can coordinate our response at a localized level, and so that we can be facing. Now, because of the lockdown, we realized that churches were closed, people could not praise and worship. It had an emotional effect on our communities, it had a psychological effect on our communities, it had a spiritual effect on our communities. So even our response at the ward-based level had to be psycho-spiritual. So the role of priests, churches, reverends, bishops was elevated to ensure that our communities keep together. Our communities are not do not collapse under the weight of COVID-19. So we had to bring in social workers, we had to bring in psychologists to start dealing with the response of our communities. Then the sub to all these is what we call the new normal readiness. We call it institutional readiness. As we recover from the pandemic, are we ready as an institution? Our communities ready for a new normal? So there's a team working on a new normal, on institutional readiness. What sort of institution do we need going forward? What sort of response to society do we need going forward as a city of Johannesburg? And lastly, on the responses is the financial recovery. The COVID-19 has had a devastating financial impact on the city's finances and on the fiscals generally. So how do we recover beyond now? Because the city still has to recover going forward. Now we're saying that given all these challenges of COVID-19, we are worried that the quadruple burden of disease that has been facing Johannesburg has been put on the back burner. We had trauma, which was low. We had lifestyle diseases, your diabetes, etc. HIV was one of them. Now, we've seen incidences of patients not going to get their antiretroviral drugs. We've seen patients not visiting their clinics anymore for checkups. And now we're worried that we're going to have a surge of disease and infections post while we're focusing on COVID, because everyone else is focused on COVID. However, we're still committed and on track with the 1990 cascade as a city of Johannesburg. So we are still fighting tuberculosis, we're fighting HIV and AIDS, we're fighting what we call lifestyle diseases, trauma being the highest killer in Johannesburg, accidents, people being hurt through violent means and all that. We are fighting all that as a city, and our city is facing that. With that, Dr. Zuniga, I say thank you very much, and we are delighted to participate in this fast track virtual conference. Thank you very much.
Thank you very much, Mayor Makubo and Mayor Belmonte, for your opening statements. I want to start the discussion with Mayor Belmonte. You issued an executive order allowing establishments that offer microfinancing loans or credits to residents to be exempted from the enhanced community quarantine. The objective was to give the poor access to loans or credit to which they cannot avail themselves from common banks. I was wondering if you could speak a bit more to the rationale, which I think is clear to all of us, but how that has gone as far as an intervention in Quezon City.
Well, in Quezon City, as you know, there are two faces to our city, as is true in many other developing countries. Now, there is a very wealthy side of it, and there are those who are very underprivileged. I really wanted to help those who were vastly affected by the lockdowns. So I issued an executive order to allow those belonging to the lower socioeconomic brackets to be able to touch base with micro-lending institutions, which was not allowed during the ECQ. But having done that, the national government, they actually understand and do allow us a level of autonomy when it comes to looking after our poor. So this was done because I wanted them to be able to avail of microfinancing and other needs, and I wanted them to be able to do this at the level of the community. So I think the greatest fear of opening up to let's say bigger lending institutions is mobility. You don't want people to move around, but when the services are in the community, in the same road or in the same neighborhood, I think these things should be allowed if they will help alleviate the poverty and the suffering of the people in that particular area. So that's something that I did there. And now in relation to recovery, I think we are the only city in the Philippines that has a stimulus package. We have allocated, well, it's not a lot of money, but it is significant in our terms, to small businesses, micro businesses that are going out of business, to be able to provide wage subsidies for their employees that are working in or that live in Quezon City. We will pay for their salaries for up to 3 months, just to make sure that they don't close shop and just to make sure that their employees continue to work and earn a living.
Sorry about that.
I'm sorry, I lost you.
Follow-up question, just to the degree you feel comfortable, what is the level of cooperation you've received as mayor from national leaders?
Well, the national government, in this particular pandemic, they are led by an organization called the Interagency Task Force for Infectious Diseases. And this is really a group composed of various cabinet secretaries. So they make the decisions with regards to what level or intensity of lockdown the whole country should be at, etc. But I do appreciate the fact that before they come to a decision, if we should be on a relaxed lockdown or a hard lockdown, etc., they do consult consult with the mayors, specifically the mayors in what we call Metropolitan Manila. So many people get confused about Manila or Metropolitan Manila. Manila is one city in the Metropolitan Manila area, which has 17 cities. So Quezon City is one of them. In fact, Quezon City is 25% of Metropolitan Manila. And there is consultation on our part. No? They ask us what we think should be the level of lockdown. And then they ask us as well to confer with one another, to come to some kind of agreement with regards to common policies, because as much as possible, they want the mayors in the National Capital Region or Metropolitan Manila to have the same policy. So, for example, our curfew should be the same time. You can debate about it all you want, but at the end of the day, we all have to agree on one time. We all have to have a mask wearing ordinance, for example. And now we are required to wear face shields. I think we're in fact the only country that this is mandatory in, right? And then with regards to the liquor ban, we all have to have the same liquor policies, etc. So in this regard, the national government, they guide us, they call us together, they consult with us, but at the end of the day, they do make the decisions, and their decisions may not necessarily be the decisions that the mayors have recommended to them. And but given the fact that they did consult with us, we are under obligation to follow whatever decisions that they eventually make, under the assumption that they did these consultations all throughout the country, and therefore whatever it is at least they decide takes into consideration the opinions and the feelings and the consensus of all the other mayors throughout the Philippines.
Thank you so much. Mayor Makubo, the same question for you. What has been the level of cooperation you've had with the national government?
We are a unitary state. We are policies made nationally, and health generally is both a national and a provincial competency. National government is in charge of policy nationally, so the Minister of Health will lead the response to the pandemic. Then provincially here in Gauteng, they're responsible for what you call tertiary and secondary health care. The municipalities will be responsible for primary health care. So we have a system called the integrated government, the IGR. So our IGR, our integrated government relations, means that we have to work together. We are enjoined by legislation that we must work together. So in the province ourselves, every week we have what you call a PCC, which is a provincial coronavirus command council, where all municipalities, all the 3 metros and the 2 districts, the 5 municipalities here in the province will share ideas. The province will give us leadership, and once in a while, the president will call the metro mayors and the district mayors in what you call a presidential coordinating committee, where we can share ideas, we can share learnings, and they can give us a way forward. So we've worked very well with our national government. In fact, the funding to fight, to repurpose our budgets and additional funding we got to respond to the virus came from national. So we think that we are well poised as a country together to fight this pandemic, and working very well as a city with the government.
Good, good. So, you know, I'm going to ask a similar question that I asked Mayor Belmonte, because similar to her executive order, which is really aimed at helping the most vulnerable in our society, you focused a lot of your attention in relation to COVID-19 in informal, densely populated settlements where we have vulnerable populations. So I was wondering if you could speak a bit to what those interventions looked like. How did you implement, for example, the mobile testing intervention to reach people in these informal settlements who might not otherwise access health centers for COVID-19 testing or other health services?
As a densely populated city, we have on the fringes of our city informal settlements where people live in not so good conditions. They live in high density locations. Their shacks and dwellings are next to each other. They live in high numbers in one dwelling. So So the challenge of social distancing and the potential of corona spread was very high, which is why in the initial stages we focused on those highly dense areas in our city, but those are the poorest areas of our city, with low access to facilities, with low access to health care, to water, to all other amenities. So the first focus was to ensure that we give them at least the basics to increase the incidence of water. If washing of hands consistently throughout the day will help reduce the spread of the virus, we then focused on ensuring that there's water throughout these settlements. And the second thing was to ensure that at least we do mass screening rather than mass testing. So to check that at least they're not showing symptoms. The ones who show symptoms then will be sent for testing. In the beginning, we did not have enough test kits to test everyone. So we relied more on mass screening, especially in these areas. The third intervention was to focus on de-densifying these areas. So together with national government, we started a program of identifying what we call the transitional relocation areas, where we can move people temporarily to facilitate social distancing. You can imagine if you stay in a one-room shack and there's 4 of you, how do you social distance in that shack? So we needed to de-densify the area and ensure that at least we can facilitate social distancing in those areas. So we then focused, we sent leadership throughout the city. And unfortunately, the poor, as they move from the rural areas, they settle on the fringes of the city. They bring rural poverty into the urban areas, turning it into urban poverty. They live far from economic opportunities. So therefore, we had to go to them to ensure that at least we reduce the incidences of the spread of the virus. And that's where we focused our effort. And I think because of the effort that we put on those areas, that's why we could contain the spread of the virus and contain the incidences of COVID-19. In the main, it became especially in the beginning, and it's prevalent more in the more opulent parts of the city, because I think they were brought through travels from overseas. I mean, the first cases were traveling from Italy into our city, and then the spread started at work. That's why the lockdown was important. That's when it went into a place called Alexander Street, and then we really encircled the area, ensured that we could contain. Now, track and trace was very good. So if we had one case of COVID, would do the tracing and tracking, and we were very successful. We were at 97%, 98% successful in those dense areas. And then we moved them to quarantine sites. So government had to give quarantine sites, and we successfully did that. Thank you.
Thank you very much. Now, I'm going to take ask you one more question, Mayor Makhubu, and that is, we're very proud of the work that Johannesburg has done as a fast-track city towards the 90-90-90 targets. And I'm wondering your level of concern with respect to maintaining the forward momentum around 90-90-90, given lockdown and disruptions in services. Could you speak to that just briefly?
No, true that. I'm very, very concerned that we might lose momentum and regress. However, as a city, our Department of Health is now refocusing that while we're fighting one pandemic, we should not start another and then lose track of the successes we've made, especially around the 90 issue. So the health department is really now going out looking for those patients, tracking them, and ensuring that we remain on track, especially with the fight against HIV and AIDS as part of the fast-track cities. So the concern is not misplaced. It's been articulated to our staff. In fact, in our planning meeting, we did say that if you don't watch, we might have a problem with tuberculosis, we might have a problem with HIV and AIDS. If you just focus on COVID-19 only. Yes, we had to respond to this new pandemic. Now we more or less understand what's going on. Let's look at the health as holistically. Let's look at health issues in totality, so that every single health issue is being attended to that as a city.
Great. So my next question is a two-parter, and I'm going to direct it to both of you, starting with Mayor Belmonte. So first, January 1st, 2020, did you ever anticipate that you as mayors of your respective cities would have to engage in city multilateralism to address an epidemic or pandemic of this size in your cities? And the second question related is, I've heard a lot from mayors about the need to exercise crisis leadership skills. So I'm just curious to know one or two crisis leadership skills that you've had to exercise in your respective cities to not only ensure a robust COVID-19 response, but to address all the other issues you're responsible for addressing as mayors of your cities. So we'll start with Mayor Belmonte.
I think your first question, Dr. Zuniga, was about intercity responses. Is that right? I kind of forgot.
The first question was, did you imagine on January 1st, 2020, that you as mayor of Quezon City would have to divert attention from all the other priorities you had to address the COVID-19 pandemic?
Oh, definitely not, actually. This came as a surprise to me. This is my first term. This is probably the most challenging thing I have ever experienced. Probably, had I known I would go through this, I might have thought twice about running for public office, to be honest. It's been the toughest 6 months of my life, these last couple of months. But having said that, I also look at this as a positive thing for me as a leader, because it allowed me to really exercise leadership. Because it's pretty normal to just go through your everyday functions as a mayor, cutting your ribbons, giving your speeches, but having to make very difficult decisions that impact on the lives of your people, having to think about how would you use your very minimal and limited resources to the best of your ability to meet the needs of the people that need them the most. These demand very, very strong leadership qualities. These demand you have to be very certain in your decisions. You have to be very deliberate in your decisions as well. No? And I think it really helps that when you lead a city, at the onset, you already have to show the traits that make people believe in you. You have to be a trustworthy leader. You have to be a credible leader. You have to be a transparent leader. You have to be a leader that tells the people what's the truth. You shouldn't hide the truth from the people. So if things are bad in your city, you should say that things are not good in our city, but we have to work together so that these things can improve. So I think one thing about being a leader in a crisis situation is honesty. That is the most important thing. But second is to be very strong. And third is to show that you're out there with the people, suffering with the people, not hidden behind the comfort of your office, but you're out there with the frontliners, risking your life. And I, in fact, did, because I did get COVID-19 as a result of my going around the villages and visiting the various quarantine facilities. No? So, on one sense, no, I did not expect to go through this. Yes, it has been very difficult. Yes, it has been very challenging. But on the other hand, I am actually quite pleased that on my first year of public office, I was thrust into this situation. And I think that if I am able to overcome the challenges brought about by the COVID-19 pandemic and my people are okay, the people I lead are okay, the city is recovering, then I think that you can now throw anything at me for the next couple of years. And I think I can probably fearlessly face all of these other challenges.
Mayor Makubu?
I was elected mayor on the 5th of December, 2019. And then we set ourselves plans to reshape the city and achieve the goals of the growth and development strategy I referred to earlier. So December, January, we're looking at planning. So on the 1st of January, 2020, all I had in my mind is how to make the city much greater and how do I put it on a growth trajectory. 1 month into office now. 3 months later, the national state of disaster was declared. So you can imagine that council adopted our revised plans, our our adapted plans for the year in February. It was February the 28th, a month into our new planning cycle. A national state of disaster was declared. So we had to shelve everything that we planned to do and now change gear and ask ourselves. In fact, I called the health experts and asked them, is this a crisis? And they said yes. And then I say, what do we do leading through a crisis? So let's change everything. It's not business as usual. It's business unusual. What are the sort of things we do? Hence we created a 6-pillar response strategy to say, let's focus on COVID-19 and go through the storm. Wait for the storm to hit. And of course, we said the tree that survives the storm is not the strongest, but is the most agile. So do we have agility as a state, as a city government to survive the storm? So yes, we did not anticipate what was going to happen. However, because we've been part of various multilateral organizations as a city, we then, tapped on our networks throughout the world. We're part of C40, we're part of Int'l, we're part of UCLG, like most cities. We're part of UCLGA, we're part of FMTV, and then all other multilateral organizations. We tapped onto that to start sharing learnings. I mean, C40 mayors started talking, like today we are talking. And then largely because, we've been part of the climate change, HIV/AIDS management and eradication, our job was made easy. However, our response needed to be localized. Our response needed to be South African responses with Joburg slants. And of course, we really appreciated the help we got from our own South African Local Government Association and all other sister organizations and sister cities throughout the world. Yes, crisis leadership skills were needed. In fact, to change gears, to put your plans on the side, to quickly have a response plan, to form a command center, and what we call an incident war room that monitored every day. We realized that you should not only be ready, but you should be ready for any disaster and any emergency. We set up an emergency center on a daily basis, and we had to be on the streets on a daily basis. We had to lead from the front. We could not say we want to be quarantined ourselves. We should not be afraid of the virus. We said, take it at great risk to ourselves. We had to be in the forefront, ensuring that these frontline workers themselves are motivated to go out to work, even in the face of this pandemic. So we decided to be amongst the workers, to be amongst the people, to tell them the truth, like Mayor Belmonte was saying, to be very honest, to tell them the truth that this thing is there, it kills, but I'll be working with you in the front line on a daily basis, visiting clinics, motivating the nurses, motivating the doctors, motivating the police, many roadblocks with them. So that's really the type of leadership we thought we should give, hands-on, on-the-ground leadership. And of course, be back to the office. What are the numbers? How do we do? What are the hotspots? What should we do on the hotspots? Who do we send there? Ourselves would go to all the hotspots. So I think it's been an interesting year since March when the national state of disaster was declared. We've learned a lot. Now we're trying to recalibrate and go back to our plans and have new plans, because in our assumptions, we had climate change, urbanization, planning for that. We did not plan for COVID-19 at all. Now our planning and our funding is focused on the new normal, on the new pandemic. In fact, I must say, Dr. Zuniga, that we're asking ourselves, is this a defining moment or a start of many discontinuities and many shocks to come? Whether COVID-19 is a defining moment in the form of like the Spanish flu, or are we, in a state of now many to come, many pandemics and or many shocks that will shock us. So our readiness as a city, our resilience as a city will depend on our assumptions that there are many shocks to come and pandemics. So we are now gearing ourselves for many shocks to come. Lastly, to say that because we believe in sustainability, resilience, and livability, we've upped the resilience pillar to ensure that our city is resilient to any form of shock, economic, public health, floods, any form of shock our city should be resilient to. Thank you.
Thank you very much. And certainly, I think that part of dealing with the shocks you're referring to is the trust that you as mayors have engendered amongst your citizens in being honest about the challenges that are faced in addressing a new pandemic such as COVID-19. And so, you know, I want to commit, certainly as a core partner of the Fast Track Cities Initiative, that we are 100% with you and understand the need to recalibrate some of our own work around creating more resilient health systems to cope with the shocks. So I would like now to ask a question of you both that's coming from one of our delegates in Montreal, our Fast Track City in Canada. She is asking, she wishes to hear about what has been done to address the impact of criminalization in the large sense, all unwanted contacts with police or the justice systems and other forms of surveillance control during the COVID-19 pandemic. I'll turn to Mayor Belmonte first and then Mayor Makubal.
Well, I'm not so sure that I understand the question. Is she talking about the role of the police in pandemic control?
We understand that in some cities, the police has been used to engage in monitoring activities around a lockdown, the use of face masks, etc. And in some instances, that has been a bit excessive, particularly when it comes to key populations, including, for example, transgender individuals.
Well, in our case, I cannot pinpoint, let's say, a specific population like transgenders, but definitely yes. One of the challenges of leadership in a pandemic is striking a balance between human rights and enforcement. And that is something that was very big here in our city, because Quezon City is a city where there are a lot of freedoms. We respect freedoms. This is where a lot of universities are located. There's a lot of social movements going on here. When there are demonstrations, they happen in Quezon City. The EDSA revolution that toppled the Marcos dictatorship, it happened in Quezon City, as did all other social movements of the past, beginning in the Spanish period. So actually, I'll just give one example. So during, let's say, Independence Day, a lot of people wanted to rally in the streets. And the police came out, well, the national government came out with a directive that rallying was not allowed, using as an excuse the social gathering is limited to only 10 persons. No? And I actually put out a statement saying that here in Quezon City, we will respect rallying and protesting, which is your fundamental human right, but you must practice the minimum health standards. I did that, no? But I was actually told to take back my my orders. So that is an example of, yes, that there is a very strong national government force that is very authoritarian in nature and that uses the police to control a lot of things going on in the name of health standards. No? So that is true. But having said that also, there are certain things as well that while they tell us, the police and the military, that these things should not happen, these things are wrong, they do give us a certain amount of autonomy. So it depends on really what is being talked about. Just last week, in fact, I'll give you another example. The chief of police said that he will be monitoring Facebook, because Facebook will show where if people have been drinking in public or have been violating social distancing, and therefore they can go arrest these people. And this got a lot of flack from the people of our country. So he took that back. He took back his words. So maybe in response to what our participant is asking, yes, the police and military were involved, especially during the ECQ, or the enhanced community quarantine in the Philippines, particularly in Metro Manila. And yes, they did play a considerable role in making sure minimum health standards were enforced. And yes, they did overstep the bounds, I think. In many cases. And another example was one man who did not have a face mask, and he was arrested right away, you know, and I think that's a little extreme, even if we do have an ordinance, because in my view, somebody should be warned first that you should have a face mask. Here's a face mask, wear that. The next time you violate, then maybe we will catch you, you pay a fine. But this man was actually, he was hit, he was treated violently. And for me, these things are unacceptable. But I understand also that we are in a very, I would say, unusual circumstance, a pandemic that has not happened in 100 years. So I'm also a little more understanding, a little more tolerant of the participation of police and army forces, because I think they themselves are frontliners and they themselves are quite unsure as to how far they can go, because they're following orders, and their orders are to maintain minimum health standards. And sometimes when you're put in a situation where you have to act quickly, think fast, make a decision right away, you sometimes cannot tell the difference when you're between respecting human rights, acting within the bounds of human rights, or overstepping these human rights. And I think this is one of the biggest challenges of this pandemic.
Thank you, Mayor Belmonte. Mayor Makubo, would you like to address the question? You're muted.
Oh,
Mayor, you're muted.
I tried to unmute.
Okay, you're good now.
Yes, it's an important question around the criminal impacts of criminalization of our population and residents who are not complying with the regulations. Now, we had the National State of Disaster Act being invoked, and non-compliance to those regulations that were promulgated as per the Act, they had fines attached to them, because we thought that there must be some punitive measures for non-compliance, because initially people didn't take corona serious. They thought it's an imported disease, it's an imported virus, it's not applicable to them, they're not traveled. And it was quite important right in the early stages of COVID-19 that we invoke this pillar called compliance, law enforcement and compliance. However, the key question is that do you give people criminal records for not complying to the National State of Disaster regulations? And the answer is certainly not. However, there should be penalties for non-compliance with what has been promulgated by our national government. So generally, there would have been many people who have been fined, have been part of roadblocks where police stations would have overflowed with people who have been arrested. Many of them paid fines. And I can tell you that the compliance started increasing, the level of compliance started increasing. People started taking this regulation seriously because it was in their best interest. But the alternative of what we did was to speak to them and say, look, we don't want to arrest you, but please comply. We find we are again in the streets during the lockdown. We will definitely take you in. The Commander-in-Chief, His Excellency, the President, Cyril Ramaphosa, of course, mobilized the South African National Defense Force because we treated coronavirus as an enemy of the people, that they must be in the streets patrolling, reinforcing our Metropolitan Police Department, reinforcing the National Police Services, in ensuring that people stay in their homes, they comply, and all that. There will be no two incidents of overreach, of heavy-handedness, but that has been dealt with by the ombudsman and all that. So monitoring was quite important for us, and I think we have achieved the numbers we've achieved, the low numbers of infection rate for the population, the recoveries, the low death rates. We've achieved them because we really took the law enforcement and the compliance pillar very seriously. However, we look dim in criminalizing somebody for going out to the shop to buy Coca-Cola during the lockdown.
Thank you so much. So in closing, I have one last question for the two of you, and it really is, What is your hope for your city and ultimately your country as we look forward to the end of the COVID-19 pandemic in the mid to long term? Mayor Belmonte, we'll start with you.
Well, the city has already passed a COVID recovery plan with the help of the city council. It's about a $500 million recovery plan. So I hope to be able to implement this, in the transition towards normal times. I am hoping that a vaccine is developed sooner rather than later. I do hope this vaccine will be made available to the people of Quezon City and the rest of the country. But in the interim, we are trying to adjust to a new normal situation, and I think we are succeeding because our numbers are going down, I think that more or less we are accustomed to these new changes already. We do not have the debates that I say they have in America, where wearing a mask is a human rights issue. Here in the Philippines, people will follow. People wear masks. People wear face shields. People will wear anything actually if you tell them it's for the good of their health, basically, my wish is that, well, I hear this vaccine should be available. If it isn't, we will adjust to the new normal and we'll recover. And we will recover and live with this virus if we have to. But life will go on here in Quezon City. Life will go on here in our country. And we have shown in history far more difficult circumstances that the human race has transcended, has overcome. And I think that this is just one of them. And this is by no means going to stop my country, my city from moving forward.
Yeah, Makubu?
Like Mayor Belmonte, I just hope that we get a vaccine soon. However, we want.
You're muted, Mr. Mayor.
Yeah, we want to get a city that is working, because COVID-19 has accentuated what has been what we call here the triple challenges, being unemployment, poverty, and inequality. They've shown the levels of inequality in our city that are quite stark. They've exposed the levels of poverty in our city that even with our deprivation map and our poverty mapping throughout the city, knowing where is poverty located, that there are some areas where we underestimated the levels of poverty. That unemployment has now reached high proportions in the city. Now, the hope is really that in the new normal, as we accept it, we confront and deal with these triple challenges in earnest, and we make our city prosperous, and we make our city livable. We hope that the city will recover, and in the recovery phase, that everyone else will accept that the old is gone, this is the new, because we've been hit by a pandemic, never in the mold of the Spanish flu of the early 20s, never in the mold of the Great Depression. Have we had such a, it's like a black swan event that has hit our city and the world at large. Now, Joburg is a very resilient city. It's one of the few cities in South Africa, in Africa, and I might say in the world, that was founded on the basis of mining, but has survived even the decline of mining, has managed to change and then create a new future, create a new economy for itself. It's now the commercial capital of our country, commercial capital of Africa. So it's built on the creativity and the resilience of the people. So we'll continue to innovate and withstand the challenges posed by COVID-19. So we're not going to despair, but we're going to be leading the city into the new normal becoming the normal, not calling it the new normal again, because it's a discontinuity. Life has changed. Life before cell phones and life after cell phones is very different. The life post-COVID will be different, and we hope that the city will embrace. In fact, successful cities, I might say, Dr. Zuniga, are the ones that adopt change very quickly, are the ones that adopt the new normal very quickly. Successful cities post the World War II are the ones that adopted even the second industrial revolution quite quicker. So Johannesburg is one of those resilient cities that I think will adopt the new normal and will be a very successful city going forward. Thank you.
Thank you very much, Mr. Mayor. And with that, we'll close the second hour of our high-level panel, I really want to thank Mayors Keisha Lance Bottoms, Mayor Kaunda, Mayor Belmonte, Mayor Makubo, and of course Mayor Medina, who moderated the first hour of the high-level panel. As I said in my opening remarks, Fast Track cities are leading, and we are very proud to have heard from you about what you've learned, what you've implemented, and your hopes for the future as we look to the end of the COVID-19 pandemic, hopefully in the very near future. Something we'll be hearing a bit more about during our keynote speech immediately following this high-level panel. So thank you very much. Stay safe and keep up the great work.
Thank you very much, and thank you to Mayor Belmonte, Mayor Kaunda, thank you very much, and all other mayors that are here. It's been a privilege to be part of this high-level panel. Thank you very much.
Thank you. Nawala na ako.